Hello, guys. How are you doing? So, for people that are here for the first time, you can you communicate me by using the chat box there. All right. So I'll give them 4 to 5 minutes so that everybody will come around. We have 7 people here. Please tell everybody to come online. Hello, Maria. How are you doing? Studying. That's good. That's good. You need it. Matthew, good evening. Welcome, eh? Please send message to your people. Let them come, all right? Because I actually have a meeting around before 10. So I want us to spend an hour, 30 minutes. It's supposed to be usually 2 to 3 hours, but we'll try to hurry up. But it depends on, Hi. How are you doing? Megali, welcome. Good evening. Welcome, welcome, welcome. I hope you have your coffee beside you. Everybody, go and get coffee. But this thing is not coffee. Oh. This is lemon and honey. Good evening. Welcome. Hello. Maya. Welcome. Yes, we are increasing gradually. We are 14. Let's allow them get to 18. Then we can start. Let's see. So, Angela, how are you doing? Welcome, man. Nice to have you. Welcome. So usually I prefer YouTube because I'm the only one that is talking. So nobody, no matter what you are saying at the background, I can't hear you until you type it. So it reduces the noise and also it helps to save the videos for your final, because for your final, you will still go back to this review. And we only give reviews for topics we've not discussed on. I understand. Yeah. Sorry. Yeah, so after the review, just go to my YouTube channel. Please, if you've not subscribed to the YouTube channel, just go now and click subscribe. And also click the notification bell so that anytime I go online, because I teach a lot of different courses. Even if I'm not a professor, it's easy for you to just join in and know what is happening. All right. So just go now and click the subscription button and the notification bell. Now, after this class, you can always go to my live. Do you understand? Like, for example, this thing now, I've reviewed this digestive system, I've reviewed it before. You understand? So you can easily just go to my live on YouTube, live videos. There is video section, there is live. So if you go to the live, you click it, you see all the live I've done. So just check the particular topic that is obtainable for you. Even for your final exam, the same thing. Anatomy is anatomy, physiology is physiology, the same questions. Nobody has time to sit down and start creating a new questions for you. Nobody has that kind of time. You understand what I'm saying when you are done with this course? You understand? There are some people that are done with this when they did 150, they understand what I'm saying. I was telling them then that this thing is the same thing, so you need to take it very extremely seriously. You understand? Yeah, so if you go there, and also there are a lot of other videos that you will see there. So I will encourage you, even after the live, go check up those videos. Do you understand? For your topic, like digestive system, because sometimes I may miss to discuss some questions, but I discuss it on the video. So go look it up. You understand? It's just an hour, maybe an hour, 10 minutes video. Look it up. Look at the review many times. And even if you are here, after this discourse, don't just leave the and wait for your exam. No, do it over and over and over. Thank you. Yeah, please try to subscribe and click the notification bell so that you'll be informed anytime we are going. And also, when that website we are building, when it comes around, the first people that will get that information are people that are in my community on YouTube. So try to join the community on YouTube. All right. Okay, so this is the first time I'm having review with you guys. So I'll give you the rules of engagement. And the rule is we are about 17 here, all right? The more people are going to join because before you know it, we get to 30, 40. So I want at least 10 people and above to respond to questions. I'm not teaching. I only explain questions that people don't understand, how we arrive to the answer. So it's not really teaching. I believe by now you are prepared for your exam. So I want you to answer as if you're in the exam hall. Once I post a question, you don't need to go and check on internet or go and look at your slide because you wouldn't do that. Thank you. Because you wouldn't do that in the exam hall. All right. So what I need you to do is to answer immediately. Pick your answer. Look at the question. Think about it. Pick your answer immediately. You understand? So immediately I get up to 10 answers. I give you the proper correct answer. If the explanation is warranted, I'll give you the explanation and we'll move on. That's how we do it. And also it will help us to be very fast because digestive system is a lot. Urinary is a lot. All right. And if you can answer very fast, it will make me give you go through many a lot of questions. And the more questions we are able to attempt here, the better for you and for me. Because I need you to pass any exam that is presented before you. All right. And this is technique we use, even in medical school. The more questions you do, the better for you. Like if you're writing your body exams, you see a lot of question banks around. You understand? Like the one we are preparing, which is Lennox Cruise, that will be launching in the next 1 to 2 months. You understand? It's something that will help prepare nurses. This one specifically nurses. But there are the ones that prepare doctors. You understand? For that are going for residency. You get? So all these things are past questions. That's how important past questions are. You understand? So please, I want you to take it seriously. But even if you don't take it seriously, after your first exam, you will understand. You will understand. Trust me. Okay. You guys are going up and down. Some people, we were 17, now we are 14. Okay. So let's just start so that we don't waste time. So please, even if you know the answer, even if somebody has answered, given an answer, and you think it's the same thing you want to give, still type it. Please. Don't keep quiet and fold your hand and watch. No. I need active participation because it spurs me on. And if you don't know anything, any of the answers, you don't understand it, please write 911, all right? Or emergency, so that I will explain it. Okay. That being said, this is my first review. That's why I'm taking time to discuss this with you. That being said, let me see. Let's start with digestive system. Are you ready? Are you guys ready? Are you guys activated? We are 12. Where are the rest? Okay. Our number is going down. I'm waiting for us to go up. We are 11. Why? Official. I salute you. Okay, guys. So let's test the microphone, guys. Let's test the microphone. Let's test the microphone. I'll give you one of the simplest questions. And let's see if you are in the mood. So look at this question, guys. An example of chemical digestion is the breakdown of dash into dash. Let me give you the options. You are ready, eh? That's nice. Let me give you guys the options. Okay, look at the options, guys. So look at the options. Protein into amino acid. Yeah, that's one example. Okay. But look at the options. An example of a chemical digestion is the breakdown of dash into dash. A, proteins, nucleotide, amino acids, proteins, polysaccharide, amino acid, nucleic acid, nucleotides, fatty acid, cholesterol. What's the answer, guys? Quickly, guys, quickly. What's the answer? This was just testing the microphone now. We've not started. You guys have to answer faster, because if you don't answer faster, once it's 1 hour 30 minutes, even if it's only protein digestion, I will stop in digestion. No. I really need you guys to answer faster to make sure I have people here. Okay. We know what a chemical digestion is, all right? It's a catabolic process, right? We have very large or complex food molecule, which we call polymers, right? Are broken down into their smallest chemical building blocks that are monomers. Do you understand? Very, very important that you understand this. And we have the major macromolecules and their monomers, which you ought to know. All right? Like, for example, carbohydrates are polysaccharides. You understand? Like example is starch, glycogen. We all know this, right? And they are broken down into what? Monosaccharides, like what? Glucose. Proteins are polypeptides, and they are broken down into amino acids. Lipids, right? Example of lipids are triglycerides, and they are broken down into what? Fatty acids and what? Glycerol. Then we have nucleic acids, also a polymer. These are broken down, you understand, by nucleases into what? Nucleotides. So if you look at that question, very well, it says an example of chemical digestion is breakdown of proteins, breaks down to amino acids, not nucleotides. So that's out. Amino acids it's not even a polymer. So that's out. Polysaccharides does not break down to amino acids. Instead, they break down to what? Glucose. Or monosaccharides. Nucleic acids to nucleotides, that's correct. Fatty acids and cholesterol are the same thing. So triglycerides breaks down to what? Fatty acids and what? Cholesterol. So that's why nucleic acids and nucleotides is the correct answer. All right. This is just testing of the microphone question. I shouldn't even be explaining this. Okay. Okay, look at this question, guys. You have to pay more than usual attention because some of the questions I won't have to give the options on the box. I'll just call it out. He say, yeah. So look at this question. The layer that is responsible for motility that propels food and residues through the digestive tract is called the dash. A, the lumen. B, the muscularis externa. C, the submucosa. D, the mucosa or the mucous membrane. And D, the serosa. What was the answer? Or E, the serosa rather. I know somebody will say, Nchebe, call this thing again. Yeah, that's the option. Okay. Now, you guys, that's the spirit. Yeah, so that's correct. The answer is muscularis externa, all right? That's the B. So you guys are very good. It's just testing the microphone. We're just testing the microphone. Okay, we're just testing the microphone. I like this, the way you guys are responding now. That makes sense. So the answer is muscularis. So even if your answer is the same thing with every other person, still put it. That's the spirit. That's the vibe. I want to be seen that I'm communicating people. All right? Look at this question. The outermost layer of the digestive tract, which is composed of a thin layer of areolar tissue and simple squamous epithelium, is called the dash. We have the lumen, we have muscularis externa, we have submucosa, we have mucosa, and we have serosa. Lumen, muscularis externa, submucosa, mucosa, serosa. No, it's okay. It's okay. Muscularis externa, we understand that's what you wanted to say. So this one, lumen, muscularis externa, submucosa, mucosa, and serosa. Perfect. So the answer is serosa. Another name for serosa is mesentery. In case of if you see mesentery in your exam, all right? If you see mesentery, that's what they're talking about. All right, serosa, mesentery. Okay, look at this question. Look at this question. Like for people that have seen that video on digestive system, you will be able to, easily answer most of this because I reviewed these questions there. Very, very important. That's why after this discourse, as you are reviewing this video, also go and review the video on digestive system and urinary system. This is A. That's the question there. This is A. This is B. This is C. This is D. And this is E. So that's the question there. Very interesting question, right? Yeah. Let's go, guys. Each of the following lists some of the tissues as tissue layers of the digestive tract. Which one has them in the correct order from lumen to external surface? Let's go, guys. Okay. It's nice that, like you guys chose this answer so that I'll be able to correct. You see, the idea of this, you understand? The idea of this is, for you to make an attempt. Even if it's right, that's fine. And if it's wrong, you'll be able to get the correct answer. The answer is not E. The answer is A. All right. They say each of the following lists some of the tissues of the digestive tract. Which one has them in correct order? From the lumen to the external surface. External surface is like outside. And what is the most outside? The most outside is serosa. We answered this some minutes ago. Do you understand? The most outside is serosa. So serosa should be the last. From the lumen that to the most external, serosa. You get it? So, like, first of all, remove any option that does not have serosa at the ending. So you remove, let me see, I remove B, C, D. So remaining A and what? A and E. So let's start from inside. If you remember the arrangement, what do we have inside? We have the mucosa, right? That's the innermost layer. The mucosa, you have what? Epithelium. After the epithelium, I told you have the connective tissue known as what? Lamina propria. After lamina propria, we have what? The muscularis mucosa. Those are just like that. Start coming. From there, we enter what? The submucosa. From there, we enter the muscularis externa. From there, we enter the serosa. So which one has that pathway? Most of you choose E. Let's look at E. You see, E says mucosa. I agree. Submucosa, I agree. Muscularis externa, I agree. After muscularis externa, it now says lamina propria. Do you see where it became wrong? It doesn't matter where they are from. Just leave those questions. Just focus. See, do you see where you guys got it wrong? Because lamina propria does not have anything to do after muscularis externa. Lamina propria is a connective tissue that just directly after epithelium. You see, you get it? Aha. So that's the point. So that's why E is wrong. So let's go back to A. A says lamina propria, muscularis mucosa, submucosa, muscularis externa, serosa, So A is the answer. So they just removed epithelium there. Because the mucosa is the epithelium, lamina propria, muscularis mucosa. You understand? So the answer is A, not E. All right? So the answer is A, not E, guys. So look at this question. Look at this question. Let me give you the options. Enteropeptides, gastrin, secreting gastrin. Just a moment. Let me give you the answer. Look at the options. So the answer says, the question says, dash is a hormone, whereas dash is an enzyme. Option A, enteropeptides, pepsin. Option B, gastrin, secretin. Option C, gastrin, CCK. Option D, gastric lipase, histamine. And option E, secretin, pepsin. Let's go, guys. Come on, let's go, guys. You give up? No, now. Don't give up. I will explain. It's nice that you brought my attention to it because I would have just given you the answer and move. Okay, yes. So guys, you guys are so correct. The answer is secretin and pepsin. All right. So since you said you gave up on this one, I will explain. They are just trying to test your ability to distinguish between what? Hormone and enzymes. What are hormones? Hormones are chemical messengers that are secreted into the blood, right? And they regulate distant target cells. But what are enzymes? Enzymes are just catalytic proteins, right? Secreted in the lumen of the digestive tract to break down food. You have to understand the differences. Secretin is actually a hormone produced by the S cells, you understand, in the duodenal mucosa. And what does secretin do? Immediately a food that from the stomach enters, because that food from the stomach has very decreased pH, it's acidic. Immediately enters the duodenum, it will burn up the duodenum. So what does the duodenum do? Immediately the duodenum secretes what? Secretin. You feel me? So this secretin, you understand, travels through the bloodstream, you understand, to the pancreas. And immediately it makes the pancreas to produce what? Sodium bicarbonate. That sodium bicarbonate will now come and neutralize what? That acidic food. That's the function of secretin. So secretin is a hormone produced by the S cells in the duodenal mucosa. But when you are talking about pepsin, pepsin is actually an enzyme, as we discussed, that is produced by the chief cells of the gastric what? Glands of the stomach. Do you understand? Normally it's produced as pepsinogen, activated by HCl, and it breaks down food, proteins specifically. Now, look at the other options. First one says enteropeptidase, and let me see, enteropeptidase and pepsin. Enteropeptidase is an enzyme. Both of them are enzymes. Enteropeptidase is found in the where is it? In the brush border. You understand? It's a brush border enzyme. Pepsin is an enzyme. We already discussed pepsin. You see? Then the next option says what again? The next option says gastrin, secretin. Gastrin, secretin. Both of them are hormones. Do you get? Gastrin is a hormone. Secretin is a hormone. We've already discussed secretin. But gastrin helps to stimulate what? Acid secretion. While secretin stimulates what? Bicarbonate secretion. Then the next option says, let me see, it says gastrin CCK. Gastrin CCK are both hormones. CCK is also a hormone. CCK is responsible for, to contract the gallbladder, right? So that the gallbladder and the pancreatic enzymes will be, the bile and pancreatic enzymes will be released. That's the function of what? CCK. Then the last one says gastric lipase and histamine. This one is just a mix. Very, very wrong. You understand? Gastric lipase is an enzyme, but histamine is a paracrine regulator. You understand? It just helps to secrete acid, secrete acid. So it's as simple as that. So that's why all those options are wrong. I'm taking time to break it down because somebody says, Matthew says, I'm giving up. I don't want you to give up on me. You have me. You can't be giving up. All right? Yeah. So I hope you guys understand it. In case of if they ask this kind of question next time, you'll be able to attempt it properly. Look at this. Look at this question, guys. If you have any question, you can always ask me. Just type it, all right? So this is a question. Option A. Option B. Option C. Option D. Option E. So the dash regulates digestive tract motility, secretion, and blood flow. Its neurons are found in the dash. We have autonomic nervous system, serosa. We have central nervous system, muscularis externa and muscularis mucosa. We have enteric plexus, submucosa, and muscularis externa. We have visceral sensory division, muscularis externa and submucosa. We have the visceral motor division, mucosa and submucosa. Quickly, guys, quickly. All right. The way time flies. Already it's 3 hours. Oh Lord. What's that? Keep going, guys. Keep going. Where is everybody? Keep going. Yes, you guys are so correct. That answer is enteric plexus, submucosa, and what? Muscularis externa. All of you know that, right? Yes. You don't know why what? Sorry. You mind typing your question properly so that I can know what you're typing before I jump to the next one? Are you asking why that is the answer? Okay, C. Okay. Now I get what they say C, but I don't know why. Yeah, so the thing is, enteric plexus is something we call the gut brain. Visceral sensory and motor sensory, motor division. I'm coming to that. So let me respond to an organ first of all. So an organ, there's something we call the gut brain, right? The gut acts on its own. Do you get? So that gut brain, or we call it the second brain of the body, is known as what? Enteric nervous system. You understand? It's a specialized branch of the nervous system that can operate independently of the CNS. Do you understand? Very, very important that you know this. Now, it's organized into two primary networks, right? We call them plexuses. The first one is the submucosal plexus. Another name for submucosal plexus is what? The myasnas plexus. I usually call it submyasna. So that I can remember, because in the exam they can tell you submucosa, they can tell you myasna. Myasna is spelled MEISSNER. That's myasnas plexus, right? This myasnas plexus or submucosa is below the submucosa, and its role, right, is to regulate the luminal surface, the glandular secretions and blood flow. Now the second one, which is also the enteric plexus, is what? Myenteric or Albach's what? Plexus. Myenteric or what? Albach's what? Plexus. So this one is located in the muscularis what? Externa. You see? So that's why the answer is enteric plexus, you understand, submucosa, and muscularis what? Externa. You understand? So the myenteric plexus is located in muscularis externa, specifically between the longitudinal and the circular what? Muscles. All right. So that one is the major one that causes what? Peristalsis. So I need you just to understand this. It's the major one that causes peristalsis. Now that option talks about let me see, autonomic nervous system and serosa. That one doesn't even make sense. There's nothing in the serosa. You understand? Then okay, somebody asked me about visceral and motor. So see what visceral and motor. That one is talking about nerve fibers. Visceral and motor are nerve fibers. Do you understand? Not anatomical organs. They are nerve fibers. They are not plexuses. Do you get? They are more like regulators, if I have to put it that way. So I told you something about when an information goes to the central nervous system, that's the brain and the spinal cord, we call it what? Sensory. When it's coming back from the brain and the spinal cord, that's the CNS, we call it what? Motor. If it is going from the skeletal muscle to the brain and the spinal cord, we call it what? Somatosensory. If it's coming back to the skeletal muscle from the CNS, we call it what? Somatic what? Motor. Somatic because it's coming back to the skeletal. Motor because it's coming back. Make sense? Now, when you're talking about visceral, if it's going, the information is going from the cardiac or the smooth muscle. Example of smooth muscle is the gut, the digestive system. It's coming from the cardiac to the smooth muscle, and cardiac and smooth muscle to the CNS. All right, we call it what? Visceral sensory. If it's coming back from the CNS to either the cardiac or the smooth, we call it what? visceral or visceral motor. You see the difference now. So that visceral motor is what we divided into two, which is the parasympathetic and the sympathetic. Do you understand? So it's not really talking about a particular place. It's just talking about nerve fibers. That's why it's not the answer. All right? Yeah. So the answer is enteric plexus, submucosa, and submucosa and what? Muscularis externa. Because the submucosa plexus is in the submucosa. The enteric plexus is in the muscularis externa, and the two of them are known as what? Enteric plexus. I hope that's clear. So Nogan and Salma, I hope you guys are clear, right? Yes, I believe you are clear. Okay, so the next question, this is that what I just posted is the option. Perfect. So the next question, what I just posted is the options. Let me pose the question proper. This is the question. So the question says the dash regulates digestive tract motility. You're welcome. The dash regulates the digestive tract motility, secretion, and blood flow. Its neurons are found in the dash. So that's the option there. A. Oh, no. Hold on. That question I posted is the one we did last. Sorry. Hold on. Keratinized lingua. Sorry. That's not the question. I was looking at it. I say, hold on. Aha. Okay. Perfecto. Look at the question here. So this is the question for that option I posted above. So the question says the surface of the tongue is covered with dash. Dash is covered with dash stratified squamous epithelium and has bumps called dash, where many taste buds can be found. A. Keratinized lingual papillae. B. Keratinized, then lingual frenulum. C. Non-keratinized, then lingual papillae. D. Non-keratinized, then tonsils. E. Non-keratinized valid papillae. Funny enough, I reviewed this thing yesterday. Was it yesterday or 2 days ago? 2 days ago, and I posted it for you guys. That means you guys didn't come on. When you guys came on that review, I posted it in your. We wouldn't even be wasting time on digestive system. We would have just jumped to the others. Because I remember I discussed all these questions. You understand? I discussed all these questions. So what we will do is, anything we didn't discuss now, please go to my live. The last live I think I discussed digestive, urinary. No, I discussed fluid in it, and urinary system. So please go there and watch it in case of if we don't have time, because it's already 38 minutes and we have not even gone anywhere. I think we've just discussed like 7 questions. You understand? So I'm just saying, for those that are coming, please try to subscribe. So please, whenever I just post, for you guys, it means that you guys need it. Just come on, or better still, put on your notification bell so that anytime you see I'm going live, you just jump in. All right, you catch 1 or 2 things. We did exactly this thing 2 days ago. I did it on YouTube here. It's on my live. But I called them. I called the answers. That's why I'm reading out the answers. I don't want to be posting in 1-1. It will waste my time. But I called the answers. Keratinized lingual papillae, keratinized lingual frenulum, non-keratinized and lingual papillae, non-keratinized tonsils, non-keratinized valets. So yes, the answer is non-keratinized lingual papillae. The answer is C. Please. The answer is C. Not keratinized. The first one says keratinized and lingual papillae. The answer is keratinized and lingual papillae. Sorry, the answer is non-keratinized and lingual papillae. What am I saying? Non-keratinized, please. Disclaimer. The answer is non-keratinized and lingual papillae. The mouth is non-keratinized, apart from the hard palate. Do you understand? So it's non-keratinized lingual papillae. I hope we are good. Lingual papillae are those bumps, on your tongue. We usually call them test buds. There are 4 types of the lingual papillae. We have the filiform papillae. We have the filiform, the fungiform, the foliate, and the valate. Yes. The filiform, the fungiform, the valate, and the foliate. Those are the 4 types of lingual papillae. All right. So those are correct. You understand? Keratinized, no. So anytime you mention keratinized, please think about the skin. All right. And lingual frenulum is just the median fold of the mucous membrane. You understand? That attaches the body of the tongue to the floor of the mouth. That's what we call frenulum. You see how it's attaching it down to the floor of the mouth? That's lingual papillae. That's lingual frenulum. The tonsils are just, they are lymphoid tissues, right? That are involved in immunity, located down at the base of the tongue. They don't have anything to do with taste. Do you understand? Then the other one the last one says non-keratinized, which is correct. Non-keratinized is correct, but it says valid papillae. You understand? So that valid papillae is correct in its own right, but that question is asking the general terminology. Sorry, I don't know what you're asking. The answer is lingual papillae. Lingual papillae is the general term for both filiform papillae, fungiform papillae, foliate papillae, and valate papillae. Another name for valate papillae is circumvallate. So did I say valate? It's valate. You are correct. It's another name for it is circumvallate, but all of them are under lingual papillae. So that question is asking the bumps. It's not specific. You understand? That's why the last option is wrong. That option that says non-keratinized and valate papillae is wrong, because valate papillae is just one type of the general thing. So the answer is lingual papillae. We good? Yes? Okay. So let's see. What do you mean? The option got, you said the answer got what? No, now look at it very well now. Oh, did I jump something? Keratinized lingual papillae, keratinized lingual frenulum, keratinized lingual. Oh, you are correct. You are correct, please. The answer, you are correct. I missed one of the options. That option is non-keratinized lingual papillae. Thank you for bringing my attention to it. Please, the answer to that question is non-keratinized lingual papillae. Please. All right. That option C, I didn't put non-keratinized. I think I mistakenly copied only the keratinized. I forget the non. So please, it's non-keratinized lingual papillae. Thank you for bringing my attention to it. Not keratinized lingual papillae. Non-keratinized lingual papillae. All right? Yes. Okay. Oh, it's attached to the frenulum. That's just the issue I have with this thing. But it's okay. At least you got my attention to it. Thank you. Thank you so much. It means you are paying attention. I really like it when people pay attention. Thank you so much. Sometimes this thing could be wrong. So non-keratinized, all right? Look at this question, guys. Look at this question, guys. Let me give you the option. You need options for this. Let me make sure I separate it very well now to avoid error due to parallax. Submandibular. Okay, look at the options. So the question is says the dash. No, the answer is there. The answer is there. The answer is C. You understand? But the non is attached to the frenulum. All right. So the answer is non-keratinized. The mouth is actually non-keratinized. Just know that the mouth is non-keratinized. Listen, the difference between keratinized and non-keratinized is that usually things that are inside but they are facing outside, right, are called what? Are usually non-keratinized stratified squamous. They are inside but they are facing outside. Example is what? The mouth. It's inside but it's facing outside. Another example is the esophagus. It's inside but it's facing outside. Another example is the anus, right? The anus is inside but facing outside. Another example is vagina. It's inside but facing outside. All these things are non-keratinized stratified what? Squamous. So the only part of the mouth that is keratinized is the hard palate. Oh, touch it. That hard palate, that's the keratinized. All right. So let's go to this one. So this one, A is lingual labial, B is submandibular lingual, C is submandibular sublingual, D is sublingual parotid, and E is lingual sublingual. Let's see. What's everybody answering? Okay. Okay, you guys are so correct. All right. You guys are so correct. The answer is B. The answer is B, which is a submandibular lingual. All right. For people that don't know, we have extrinsic and intrinsic. When we are talking about extrinsic, we are talking about the salivary glands that are located outside the oral mucosa. Outside the oral mucosa. Intrinsic are the ones that are within the oral mucosa. All right. Example of extrinsic is the parotid. You understand? The submandibular and the sublingual. Those are the three that are what? Extrinsic, they're outside the oral mucosa. Then when we are talking about the intrinsic are the minor ones. Talk about the lingual glands, talk about the labial, talk about the palatine, talk about the buccal. All these things are intrinsic, all right? Yeah, so the answer there is sublingual, submandibular, and lingual. That's the answer. Submandibular and lingual, that's B, all right? Okay, so look at this question. Look at this question. And the options. Hold on, let me give you the options. C is the so this esophageal and E is pharyngeal. So this is the option. Acid reflux into the esophagus that's heartburn is normally prevented by dash. We have the pharyngeal constrictors. We have the upper esophageal sphincter. We have the lower esophageal sphincter. We have the esophageal glands. We have the pharyngeal and buccal sphincters. Let's go, guys. Let's go. Let's go, guys. Sharp. Yes, it's LES. It's the lower esophageal sphincter. I believe all of you know this one. Eh? So this one I want to give you, I'm not going to give you option. I just want you to write the answer for me. Yes, the answer to that question is LES, all right? Look at this one. I'm not giving option, please. I need you to give me the answer very fast. Let's see people that are studying. Infants have dash deciduous teeth, whereas adults have up to dash permanent teeth. What's the answer to the two of them? Quickly, quickly, quickly. No option, no option. Hell, you put question mark. Yeah. Yeah. Let's see people that are active. You guys are so correct. Please, 2032. 2032. This is a formula you can never forget throughout your nursing career and throughout your medical career. For those in medicine, those in nursing, those in physiotherapy, and this thing is 2032, all right? So look at this. Now, this is the option to the question I want to ask. This is the question. The question says, which of the following is correct list of tooth anatomy from the most superficial to the deepest? Look at it there. A, cement root canal enamel. B, enamel root canal dentine. C, dentine enamel cement. E, D, enamel dentine pulp. E, crown enamel dentine. Come on, guys. Test yourself. Test yourself. You don't need to Google the answer. I need you to answer as if you're in the exam hall, guys. If you're feeling sleepy, just do like this. Do like this. Why am I always looking up? I'm seeing you guys here instead of looking down. Forgot the camera is here. Let's see. Let's see. Keep going, guys. Okay, guys, you are so correct. The answer is D, enamel dentine pulp. That's the answer. That's the sequence it always follows. All right. So you can't forget that. Now look at this question. Look at this. Yes, you guys are so active. I feel it. I feel you. I feel you. I love it. If you are like this now, I'll be very happy. Look at this question, guys. Let me give you the options. I know some people will even pick the answer before I give the options. There are two answers there, but to avoid wasting time, that's why I am going to give you option. See, active. Oh. Hey, now you guys are ready for exams. So what am I saying? I'm even still about to post answer. Hey, that means you guys have watched those videos, so that's good because it's the same thing. You see, now I have to jump to the next question, and it makes life easy for me. Yes, I love it. Yes, perfect. Okay, you guys are so correct, eh? You guys are so correct. The question say carbohydrate digestion begins in the mouth, yes, whereas protein digestion begins in the stomach. Perfect. So look at this question. This is the option to that question. So the question says, which of the following is normally not found in the saliva? Which one do we not see in the saliva? Which of the following is not normally found in the saliva? Please, if there's any question you are confused on how we got the answer, please try to speak up. All right, that's why you have me here. In as much as I'm trying to be very fast, I prefer you understand it so that if you see something similar, you don't forget. People are active. Oh. Let's go, guys. Let's go, guys. Let's go. Pick the answer as if you are in the exam hall. Okay, guys. So let's talk about this. The answer is protease. All right. Yes, the answer is protease. Protease is which option? E. The answer is protease. All right. Now, some people will be like, why is it not lysosome? Because lysosome is actually an antibacterial enzyme that kills bacteria by breaking down their cell walls, right? And they are actually found in the oral mucosa because they are defense against oral pathogens. All right. Mucus is to lubricate food. That one, everybody knows that one. Amylase, salivary amylase in the mouth. Lipase, we have lingual lipase in the mouth. So the one that is not in the mouth is protease. Do you understand? Protease is not in the mouth. Oh shit. You understand? Because proteases contain have to break down what protein, and protein digestion does not begin in the mouth. So proteases are not found in the mouth. So that's why protease is the answer. And it's good that you made the mistake here, than making it in the exam hall in case of if they ask you. You understand? Okay. Look at this question. Let me see if you get it before I pose the option. The swallowing center is located in the dash. Let me see if you get the answer before. Yes, the answer to that question is protease. Let me see if you guys will get the answer before I pose the options. Okay, look at the option. The swallowing center is located in the dash. We have the mouth, we have the oropharynx, we have the esophagus, we have the medulla oblongata. Let's go, guys. Let's go. Let's go. Pick any answer you think you are going to pick in the exam hall. All right. Don't pick answer that somebody else, you know, just because somebody else picked it and you think your own is wrong. No. Okay, yes, the answer is medulla oblongata, all right? Not oropharynx. The answer is medulla oblongata. You need to know that swallowing, another name for swallowing is what? Deglutition, because they can ask you. You understand? So deglutition or swallowing is actually a complex physiological process that requires coordination of more than 20 muscles in the mouth, pharynx, or esophagus. All these things have more up to 20 muscles that are coordinated by the medulla oblongata, all right? So, you know, when there is sensory input, when a food enters your mouth, it reaches the posterior wall of the pharynx. You understand? It causes this something we call tactile receptors. You understand? See, this tactile receptor, they send message straight to the medulla using the trigeminal and the glossopharyngeal and vagus. Yeah, trigeminal, glossopharyngeal, and vagus. Yes, the three of them. You understand? They are the ones that are used to send sensory information upwards to the medulla. Not just the medulla, some part of the pons, yes. It's in the brain, of course. Some part of the pons, all right? So that's sensory input. Then the medulla will say, oh, okay, he wants to swallow. Okay, we have to make the muscles open. Some of them will contract, some of them will relax. So the medulla will not send information back. You understand? You understand? A lot of people using the cranial nerves, like the hypoglossal nerve, all right? Back to the muscles of the throat and esophagus and tells it, open, this person wants to swallow. Or open, food has to go down. So you see, that's sensory and the motor that we've been talking about. But this coordination, the interpretation of that information of deglutition or swallowing is done by the medulla oblongata. That's why it is what? The center, the swallowing center. You can't forget. You literally cannot forget. You can't afford to forget. Do you understand? Because a patient may come to the clinic and they'll be like, oh, this patient has dysphagia. It cannot swallow. You understand? The problem may be in the medulla. Maybe the information is being sent, sensory is being sent, but the medulla is not translating it to swallowing. So the motor is having a problem. Or maybe the medulla is working, but the motor nerves that are coming back, the hypoglossal nerves, are not functioning. Or even maybe the nerves that are carrying the information to the brain is not even functioning. It can just be any problem. But remember, anatomy is what? Location, location, location. And physiology is what? Function, function, function. So we are trying to know the right function for us to be able to, so that if we see the pathology, we'll be able to understand. You understand? Yeah, something like that. So the swallowing stator is in the middle of oblongata, right? Yes. Yeah, the anatomical structures are usually the ones that all these oropharynx and blah, 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 and all those, but it's coordinated. When they say center is like something that's the place that's coordinating the entire activity. That's what they mean by center usually. Okay, and not just the middle oblongata, even some parts of the pons. It's also part of it. Okay. Okay. Look at this question. Look at this question. A, voluntary, involuntary. B, involuntary, voluntary. C, voluntary, voluntary. D, involuntary, involuntary. Voluntary, involuntary. A, B, involuntary, voluntary. C, voluntary, voluntary. D, involuntary, involuntary. Yes, you guys are so correct. That's testing the microphone question. No? And you are very correct. The answer is voluntary, involuntary. Look at this question. This is three-part question. Three-part question. I know somebody is going to answer this question before I finish posting the options. Because you guys are hyperactive this night, and I love it. I am so loving it. Look at this question. That's A. This is B. This is C. This is D. Okay, since somebody has answered, let me stop at that point. So pepsinogen is produced by dash and is activated by dash, which is secreted by dash. Very technical. Very technical. Let's go, guys. Yes, you guys are so correct. The answer is B. Pepsinogen is produced by chief cells, right? And is activated by what? By HCl. And HCl is secreted by what? HCl is secreted by parietal cells. So the answer is B. So please, if you see this question, you have to follow it like that. There are different, more questions like that, all right? But I'm not going to post them because, this represents all. So look at this question. Please, you have to pay attention. I'll just read out the option so that I read it out once instead of more than once, all right? And then you tell me your answer. It helps us to be faster. We already spent more than an hour and I'm still on digestion. So look at this question. Necessary for vitamin B12 absorption, dash is or are secreted by dash cells. A, intrinsic factor parietal. B, bile salts chief. C, lecithin hepatic. D, hydrochloric acid parietal. E, enteropeptidase mucus. You know, for people that are not attempting, the beautiful thing about attempting is that you feel the groove. Trust me, you feel that vibe in you. And if you see a similar question like that, just the fact that you attempted it will make you remember. Trust me, it will make you remember. But you may be here looking and you still see that question and you fail it or something similar. Why? Because your brain didn't, exercise on that particular question. So that's why I will encourage you. Even if people are posting that and still just the fact that you type it, you understand, will help you to remember, right? Necessary for vitamin B12 absorption, intrinsic factor is extremely important. It's secreted. What does this intrinsic factor do? Intrinsic factor helps to clothe vitamin B12 because the HCl will destroy it. Yeah, okay. So that's why I'm explaining it now. You understand? So, hold on. Okay, let me bring out this thing. So, as I was explaining, you must know this thing. It's extremely important. All right. So intrinsic factor is actually produced, or is let me first of all explain what it is. It's a glycoprotein. When we say glycoprotein, it's a protein that has carbohydrate on it, right? And it's very, very essential for life. The function of intrinsic factor, the only function of intrinsic factor is to bind to vitamin B12. Another name for vitamin B12 is cobalamin. You understand? It binds to vitamin B12. And what is its function? Protection. Protection. So vitamin B12 is big and it is fragile. You see, puffy baby is big and fragile. So because of that, the intrinsic factor helps to protect it so that, it will not be broken down in the stomach. So it covers it, carries it as it's coming down and takes it to where? The intestine. You understand? And crosses the duodenum and goes where? To the ileum. Distal part of the ileum. And immediately it gets to the distal part of the ileum, it breaks away from vitamin B12. Intrinsic factor breaks away from vitamin B12 and the ileum takes it up and puts it into the bloodstream. You understand? And it is produced by what? By the parietal cells. So the parietal cells produces the HCl and also intrinsic factor. Extremely important. That's why if they cut off somebody's they do gastric cutting, right? Or bypass. You understand? The person will start having anemia because intrinsic factor is very important. Vitamin B12 is very important for creation of blood cells. I don't know if you understand me. For blood production, very, very important for blood production. So without it, you understand, nothing will happen. Yes, from the stomach to the ileum. Yes, immediately it enters the stomach, it will cover it and take it to the ileum, bypass the duodenum and take it to the ileum. Yes. Okay. Okay. So I think that serves that its purpose. We already know where HCl is produced, so I'm not going to talk about it. Okay, look at this question, guys. Look at this question. Yes. Look at this question. Which of the following enzymes functions at the lowest pH? Salivary amylase, pancreatic amylase, pepsin, trypsin, dipeptidase. salivary amylase, pancreatic amylase, pepsin, trypsin, and dipeptidase. Which one? Perfect. You guys are so correct. Yeah, it works in the stomach, and because of that, the stomach pH is very low, so very acidic. So that's why pepsin is the answer. Salivary amylase, mouth pH of the mouth is between 6.8 to 7. Pancreatic amylase, pancreas pH of the pancreas is between 7.5 to 8. Which one again? Trypsin. Trypsin is also pancreatic protease, right? It functions in the small intestine, and pH is there is 8, so it's high. We have dipeptidase. Dipeptidase functions in the brush border, right? Located in the microvilli of the small intestine. pH is around 7 to 8. So the one that works in the pH of 1.5 to 2 is what? Pepsin, because it works in the stomach. I believe you guys understand the breakdown. And you know the cell that is responsible for HCl production, that's parietal cells. Everybody knows this. So I don't need to start wasting time on it. Okay, look at this question. Oh boy, I have to be done with this. So look at this question, guys. That's the question. These are the options. That's A. That's B. That's C. That's D. That's E. Which is the answer? Which of the following is not a function? It's not. Please, in digestive questions and urinary questions, they always put not. So don't jump into it and get it wrong. Which of the following is not a function of the gastric hydrochloric acid? Activate pepsinogen to pepsin, activate lingual lipase, emulsify lipids, destroy ingested pathogens, convert ion 3 to ion 2. Which is not. Come on, guys. Are we getting tired? Please don't get tired of me. Please. Yes, the answer is emulsification of fat. That's for bile, all right? That's for bile. Look at this question, guys. I already posted the option. So let me give you the question. So the question says, look at the question here. Yes, emulsification of fat, you're correct. The question says, the dash phase is associated with food stretching the stomach and activating myenteric and vagovagal reflexes, which in turn stimulates gastric secretions. Which phase? We have cephalic, we have gastric, we have intestinal, we have gastrointestinal, we have mesenteric. You're not sure, eh? That's fine. You guys are so correct. All right. The answer is gastric. If you don't understand, I can explain gastric. Just note the stimuli, that's distension usually, or increase in pH as food is neutralized, in the by the intestine, or stretching of the stomach wall. That's it. The stimuli. Then the reflexes, we have the myenteric reflexes, which is coordinated by the Albach. All right, myenteric plexus. That's Albach. Yes, gastric 100%. Okay, so you guys are good. Then the vagovagal reflex by the vagus. Your board questions, they usually ask about the vagus nerve. You understand? So the sensory, vagus, motor, vagus. You understand? Takes the information to the brain, and the brain says, okay, oh, you have to stimulate gastric motility. Pium, it comes back and starts stimulating gastric motility and what? Secretion. That's vagovagal. 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 Vagus, vagus. That's what it means. So vagovagal reflex and myenteric reflex. Myenteric reflex is talking about the myenteric plexus. Those are the two that controls it. Then you have the hormonal response. Now, presence of hormone, things like proteins, increases the pH. You understand? By stimulating the G cells to release what's gastrin. And gastrin, stimulates the parietal cells and the chief cells to produce HCl. So that's gastric phase, So I believe you understand both gastric and intestinal phases. Very, very, very important that you understand this. And also cephalic when you are thinking. Okay. Let's see. There's another question that's asking what are the three phases of gastric secretion. I'm not asking that. I'm not discussing that here because I know all of you knows it. CGI. Good. This is one of the questions that came out last time. And a lot of students failed this question. This is A. So please, whenever we are doing review, if you have friends, anywhere, any school, tell them to join us as far as they're doing that course, because this cuts across every institution. You understand? Any country, doesn't matter the country. You understand? Because if you know vagovagal reflex, you know it. Anyway, they ask you, you know it. So it's not about whether you are in this school or in that school. No, the same thing. At the end of the day, you guys will write body exam, and body exam, like NCLEX, even people that are in Nigeria writing NCLEX, the same question. So it's not whether you're in the US or Canada or Australia or whatever. The exam, anatomy is anatomy, physiology is physiology. Location, location, location. Function, function, function. So let's talk about the enterogastric reflex, guys. What is the function of enterogastric reflex? Let's go, guys. Let's go, let's go, let's go. Pick your answers if you're in the exam hall. You don't have more than a minute. Okay, let's go, guys. I got this question now. Okay, a lot of you have answered, and that's good. Ah, where's everybody? Come back, guys. So enterogastric reflex, right? It's just very vital in breaking down. It's very vital. You understand? Vital mechanism that helps to prevent small intestine from being overwhelmed by more chyme than it can effectively what process. All right? Very, very important. You get? And if you want to know how it works, I will explain. But the answer to that question is inhibiting gastric motility when there is chyme in the small intestine. You understand? That's the answer to that question. It works with stimuli, that's distension of the duodenum, or acidity. When an acid enters the duodenum will know, oh, there is food coming in. That's enterogastric reflex. Entero, small intestine. Gastric, stomach. Oh, the food is coming from the stomach. Immediately the duodenum distends, it goes into effect. Or immediately there's an acid in it, it goes into effect. Because another question can be asking you, what are the stimuli? You see, what are the stimuli that encourages enterogastric reflex? One is distension of the duodenum. So if something enters the duodenum will know, oh, this thing is coming from the stomach, and it will go into effect. That's one. Secondly, acidity. Duodenum is basic. So if you see something that is acidic, exactly. Do you get? And another thing, no, it's not stomach, intestine. Do you understand? It's usually when there is chyme in the small intestine. When something enters the small intestine, it's coming from the. So those are the second two things. Another thing that is leads to enterogastric reflex is what? When there is presence of fat and protein in that food. So these are the three things that causes enterogastric reflex. That's the stimuli. And they may ask you, what is the neural pathway? Inhibiting is the vagus nerve. Do you understand? It inhibits it. Stimulating it is the sympathetic nerves. All right. Then they can ask you, what are the supports? What does the duodenum do when it is distended? What does it do when something with low pH enters? What does it do when there is fat and protein in the food? You understand? The duodenum immediately releases hormones like what? Secretin and cholecystokinin. You understand? And what they usually do is, they neutralize that acidic chyme. That's one. And also they stop the stomach from pouring more food into the duodenum. So the stomach pours food in squirts, Pum, squirt, it stops. This guy processes, squirts. This guy, yes, official, you know what I'm. Yeah, exactly. That's what I'm talking about. Squirt, it processes. Squirt, it processes. Do you understand the points? Yes. Yeah, it stimulates intestinal motility when there is food in the intestine, not when there is food in the stomach. That's just what I want you to get. Then the squirting continue happening. Okay, guys. So we are good, right? So the answer to that question is D. Inhibits gastric motility when there is chyme in the small intestine. Once the chyme goes out, it allows it to come in again. All right. So look at this question that's talking about the triad. In the next 6 minutes, I'm going to stop digestive system. So please pay more than usual attention to these few last questions. Oh boy, this question is long, man. No, you don't need to delete. Don't delete your answer. It's okay. It's okay. Don't delete your answer. It's fine to get it wrong. That's why you have me. This is B. This is C. This is D. And this is E. So the hepatic triad consists of what? Come on, guys. A hepatic triad consists of what? So you guys are so correct. The answer is, let me see, is the right, left, is hepatic portal vein. The answer is D. Yes, a bile duct, duct 2, a branch of the hepatic artery, and a branch of the hepatic portal vein. Yes, those are the three. Right. So if you see the, you must know what hepatic portal vein is, what triad is. Triad is 3. Hepatic triad is those 3 things: the duct 2, the artery, and the vein. You can't forget. What was the time? 126, 127, 1 hour 27 minutes. Okay, you know what? Let me ask you this. 2 more questions. No, Nogan. I hope you got the answer is a bile duct 2, branch of the hepatic artery and the branch of the hepatic portal vein. All right. Leave all those common hepatic ducts. Just leave them alone. All right. Let it breathe. Aha. The answer is D, a bile duct 2, a branch of the hepatic artery, and a branch of the hepatic portal vein. So please, if there is an answer you don't get, all right, please make sure you go back to the video, follow it up and make sure you get the right thing, please. All right. So that you don't make mistake. Okay, guys, let me put the options for this. Yes, got it. Okay, perfect. Because you are making a lot of sacrifice being here with me this evening, so I need you to have an advantage over people that are not here, so that next time they will take off from work and be here. But please, after this, I don't know when. After this, please go back to this video. Don't just take only the knowledge you have here. Go back to the video, watch it over and over again. Understand it very, very well. Know why something is not the answer. Compare it with your slide, if possible. All right. And also, I have a video on digestive system. Please go and look at it. Which of the following is the proper sequence by which proteins are digested by different enzymes? Quickly, guys. That should be the last question for this digestive system, so that I will have time for this. Please, for fluid, I need you to go and watch the fluid review I did. The last review I did before you, I did fluid. Please go and look at it. All right, because I will not be able to do it today. Please, I'll try to do urinary system as fast as I can, but please go and review it. All right. So what's the answer to that question? I'm always touching this my beard as if it's so long. Somebody said one day, Nchebe, this your beard is no longer. Why are you touching it like that? Okay, guys, I need you to know that there's something we call endopeptidases and what? Exopeptidases. All right? Endopeptidases and exo. Yes, the answer is A. You are correct. There's something called endopeptidases and exopeptidases. So pay attention. Let me explain this thing for you. First of all, the first this thing there is pepsin. Guys, it begins the process in the stomach. Pepsin, remember, it's produced as pepsinogen, right? Aha, by the chief cell, and it is activated by HCl, produced by the parietal cell. Now, pepsin is an endopeptidase. What does it do? So I need you guys to look at me. Let's assume this is a polypeptide bond, different amino acid, 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 amino acid. What pepsin does is it will just come to this middle and cut. So there's a group of amino acid here. There's a group of amino acid here. So, you know, it's breaking down the protein, but it's still breaking it down and leaving it as what? As a poly. You understand? As a poly. So it's called endopeptidase because it comes to the middle and cuts. Do you get it? Then after that, the protein goes to the intestine. In the intestine, do you understand? There's something called the carboxypeptidase. All right? Before that, there's something called the trypsin. Before we go to the carboxypeptidase, there's something called the trypsin. So the trypsin also produces a trypsinogen activated by the enteropeptidases, all right, to trypsin. So what trypsin does, or rather activated by enterokinase. So what trypsin does, you know, is that trypsin will do exactly what pepsin does. Trypsin is also an endopeptidase. So you see, pepsin cuts this thing into this large oligopeptide and this oligopeptide. Trypsin will come to this middle and cut it again. Come to this middle and cut it again. So it's still an endopeptidase. It's cutting the polypeptide bond that is in the middle, inside. So from pepsin converts polypeptides to oligopeptides. Then trypsin still converts it to other fragments of oligopeptides. Then after that, we have the carboxypeptidase. So the carboxypeptidase, right? This one is an exopeptidase. What is an exopeptidase? You see, let's assume this is where the trypsin leaves the oligopeptide. Carboxypeptidase will come to the ending. That's why it's called exo, and cut off this amino acid. Come to this ending and cut off this amino acid. Come to this ending, cut off this one. Come to this ending, cut off this one. But there is still oligopeptides, right? Aha. So the final one is now dipeptidase. That one is found in the brush border. You understand? Where absorption happens. So dipeptidase will now break. It's also an exopeptidase. It will now break to pieces. So I need you guys to understand it, all right? And also carboxypeptidase targets the carboxyl, the COOH end. All right? While the dipeptidase targets the amino end. Also remember that. But that's, by the way, just know the sequence. That's enough. Okay, guys. So I'm jumping into urinary now because we don't have a lot of time. Sorry, I'm taking a lot of time explaining these things, but I need you to have a difference between you. There to be a difference between you and people that are not here. And so that when you are listening to this video, you can jump to the part you want to listen to, all right? You can remember. So I'm jumping to the urinary system. Are you guys ready? Are you activated? Are you guys ready and activated? Yes? Okay. I feel you. I feel the groove. Let's see. No, we can't do fluid and electrolyte this night. It's impossible. I have very limited. I have a meeting, so it's impossible. I'm looking at the time right now. It's impossible. So please, if you go to my YouTube channel, you will see live review. Go to the live review. The last review I did before now, open it, I did fluid. Use it. Please. Go through it over and over again. Just go to the fluid part. All right. And also, I may not even finish urinary system this night. Also, urinary system is there. Please don't joke with it. Go and look at the video as well. Like, you need to be too prepared. Over preparation is better. Yes, watch the video. I want you to be too prepared. Do you understand? Like, you enter, your head is hot. So you are saying, Nchebe, bring it. People are getting 100, over 100, even in the final. People that are actively prepared. So don't just watch it once, or maybe because you are in this class, you leave everything, you go to the exam hall. You will remember, but you not remember everything. All right? And every question, every mark counts for you. So I'm bringing out this time, and you are bringing out this time. So use it well. Okay. I don't know if they are part of the exam, good. If they are not part of the exam, it still doesn't matter. The most important thing is that you understand it. All right. And if you see something similar, you'll be able to answer. That's why I'm taking time to explain them. All right. This is a review, not your exam. All right. So, but I will encourage you to take it seriously. As I keep telling you, any exam you are preparing, use question banks. Sometimes it's better. For example, if I'm preparing for an exam, I can take the slide now, especially now that there is onset of AI. You can just take the slide, put it in PDF form, upload it in one AI, tell it to generate 200 questions for you from this. That you should serve as your professor and generate 200 questions for you. You see? The more questions you attempt, the better you will be in the exam hall. Trust me. Okay, guys. Options A. And which is exactly why we are building what we are building, to be able to help you guys in the college, both the nurses and others. C. D. E. So, which of the following is not true about the anatomy of the urinary system? What's the answer, guys? Which one is not true? The kidneys are retroperitoneal. The ureters connect the kidneys to the urinary bladder. The urethra of males is longer than the urethra of females. The kidneys are at equal heights within the pelvic cavity. The right kidney is located more inferiorly than the kidney. Let's see people that are active. Activate. Let's see this question. This question. Testing the microphone. Trying to jump some of these questions. She's not longer on the urinary system. Oh boy. This is good. I really love the response. The answer is D. The kidneys are at equal heights within the pelvic. They are not at equal heights. The liver is suppressing the one at the right. That one is lower. So every other thing is correct. That's why the question is, which of the following is not true? So the one that is not true is D. All right, Matt. The answer is D. All right. The ureters connects that's the difference between ureters and urethra. The ureters connect the kidneys. Yeah, no, it's okay. The ureters connect the kidney to the urinary bladder. So this is the kidney. You understand? Then this is the urinary bladder. That connection is the ureter. T-E-R. Mind you, there is tra and there is ta. Okay, look at this question. We are still testing the microphone, guys. This is the question here. So please, I really need you guys to go watch that urinary video, because there are some questions I won't be posting here, and you may see something similar. I'm really working with time here. Yes, Matthew, they are asking you which one is not true. Do you understand? Others are true, but which one is not true? That's why that D is the answer. So always watch out for that, because in urinary and in the, yes, yeah, of course. You understand? In urinary and in digestive system, they're always doing that. No, it's okay. It's okay. It's okay. It's better you get it wrong here than you see something similar in the exam hall and you get it wrong. You understand? So it's okay. That's the idea of this discourse. This is review, remember, not teaching class. Of course, if I'm teaching, you know me now. So which of the following is not a function of the kidneys? A, they regulate osmolarity of the body fluids. B, they fight osteoporosis by synthesizing vitamin D. C, they help control blood pressure. D, they release a majority of wastes into the bloodstream. And E, they indirectly increase oxyhemoglobin. What's the answer, guys? Let's go. Yes, I love the fact that you guys are putting it. See what I want you to do? Look at the question, think about it, put your answer as fast as you can. Just exactly how you do it if you're in the hall. Because if you're in the hall, you are not going to see what every other person is answering to pick from them. All right. So I need you guys to be that. You don't need to browse any. I don't want you to browse anything. Just let's focus and do this. All right. As if you're in the exam hall. So we are doing practice. You guys are so correct. The answer is D. Yeah, some people say B, but I'll tell you why B is not. It's wrong. Look at the question. They say which one is not. You see, please, guys, please. Most of this question we have not, except. You get except not. So you have to look well, all right? It's not a function. So what are the functions of the kidney? They regulate osmolarity of the body fluid. That's correct. They fight osteoporosis. Yes, they synthesize the active form of vitamin D, which is calcitriol. Remember, vitamin D, the synthesis starts from the skin, 7-hydrocholecalciferol. From there, it enters the liver. The liver produce that, convert that 7-hydrocholecalciferol to calcidiol. Then that calcidiol is still inactive. It now enters the kidney and it's now produced as what? Calcitriol. You understand? So that B is correct. It's the function of the kidney. All right. Then the third one says they help control blood pressure. Of course, it helps control blood pressure. Then the last one says they indirectly increases oxyhemoglobin. Of course. So the answer is D. Why is D not D the answer? The answer says they release a majority of waste into the bloodstream. Do they? No, they release it into the urine, not bloodstream. So that's why the question says which is not a function. I hope you guys are clear. Yes. So look at this question. This question is very easy, but I know it will throw a lot of people off balance, of course. So I need you to pay more than usual attention. Yes, everybody. What happened? Are they running away? Are they tired of me? Are they tired of seeing my face? So the question here says the byproduct of urea catabolism is what? We have byproduct of protein catabolism is what? We have urea, we have creatinine, we have uric acid, we have exothermia, and we have ammonia. We have urea, creatinine, uric acid, exothermia, and ammonia. What's the answer, guys? Let's go, guys. Let's go. Let's go. Where is every other person? Where did they run to? So you guys are so correct. The answer is urea. All right. Creatinine is a waste product of creatine phosphate. All right. Uric acid is a waste product of what? Nucleic acid. Do you understand? Ammonia is just a byproduct of protein catabolism, just a byproduct. And azotemia is just a clinical state. All right, which is characterized by high concentration of what? Nitrogenous waste, like urea and creatinine in the blood. You understand? Usually exemplifying. Yes, I did. Usually exemplifying renal failure. All right. Aha. So when there's a high BUN, blood urea nitrogen, maybe there's high urea or there's high nitrogen. It's a sign of what? It's azotemia. All right. It's azotemia. Very, very. And if it is too low, it's usually a sign of severe liver disease. Too high kidney, too low liver. Okay. So the answer is urea, right? This one is just testing the microphone. Let me give you another test of the microphone question. I'm not giving you options in this one. Yes, urea, you're correct. He said test on the microphone for 90 minutes. I'm sitting. That's the microphone for 90 minutes. I look at this question. He's still testing. Don't make me laugh, man. He's still testing the microphone question. Oh, God. Okay, let's go, guys. Let's go, guys. Let's go, guys. What's the answer? Medulla capsule, cortex, hilum capsule. What's the answer? This one we are not supposed to waste time. This one is supposed to be cha 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 cha, very fast. You'll be like, Nchebe, bring it on, bring it on. So yeah, the answer is hilum. They may ask you another question like blood vessels, nerves, and renal pelvis enter and exit the kidney. At where? Hilum. Anything the door is hilum, all right? Okay. Let me still give you. Yeah, the answer is hilum. You guys are correct. Look at this question. Hilum. Yes, hilum. Look at this question. A renal pyramid voids urine into the dash. Yes, the answer is hilum. Yes. A renal pyramid voids urine into the dash. Yes, I know. Into the dash. What's the answer, guys? Minor calis, major calis, medulla, papillae, urethra. What's the answer? A renal pyramid voids urine into the dash. A renal pyramid voids urine into the minor calyx, major calyx, medulla, renal papillae. Still testing of the microphone question. Matthew. Matthew said, I don't understand it. Come on, guys. What's the answer? So funny. Yes, you are so correct. It's minor calyx, all right? I'm trying to step up faster. I'm trying to run faster, so I need you guys to move with me. It's minor calyx. Look at this question. Blood plasma is filtered in the dash. Tubu, corpuscle, capsule, column, calyx. Blood plasma is filtered in the dash. Where does filtration happen? Tubu, corpuscle, capsule, column, calyx. Tubu, corpuscle, capsule, column, calyx. Yes, you guys are so correct. Please, the answer is corpuscle, not capsule. They put it there to confuse you. Trust me. Trust me. It's renal corpuscle, corpuscle. That's corpuscle, renal corpuscle. All right. That renal corpuscle is where filtration, where that initial filtration happens. It's divided into the glomerulus and the Bowman's capsule. Corpuscle is divided into glomerulus and what? Bowman's capsule. All right. Just think about it as the initial sieve. The initial sieve. All right. Aha. Tubu is where reabsorption and secretion happens. Capsule, when you're talking about capsule is just the outer skin wrapping the entire kidney. All right. Help it to maintain shape and provide protection. That's capsule. Column are just extensions of the renal cortex. You understand? That projects inwards. You remember? Column. Projections of the renal cortex that projects inwards into the medulla. Then calyx is something like, looks like cap-like structures. You know, it helps to, renal calyx just helps to collect urine after it has been fully formed. All right. Just like a funnel. Calyx is just like a funnel that channels all the urine into the renal pelvis and urethra. So the answer is corpuscle. C-O-R. How do they spell it again? C-O-R-P-U-S-C-L-E. Yes, L-E. Yes. Corpuscle, yeah. Okay. Oh boy. Look at this question, guys. A, B, C, D. What's the answer, guys? A single lobe of the kidney is comprised of what? 2 calyces and a renal pelvis, 1 pyramid and the overlying cortex, 1 major calyx and all of its minor calyces, a renal medulla, and 2 renal columns. What's the answer, guys? Come on, guys, let's go. What's happening? A single lobe of kidney. When we say single lobe of kidney, remember an individual have 1.2 million nephrons. That one, I don't need to waste time on it. Yes, you guys are so correct. One pyramid and overlying cortex. That's the answer, guys. Let's not waste time on it. Okay, guys. So now let's go to the questions that are not testing the microphone questions. Yes, one pyramid and overlying cortex. You're correct. You're correct. So which of the following is not composed of cuboid epithelium? This is A. This is B. This is C. So I'll give you just those three options. What's the answer? Which is not composed of cuboidal epithelium? Quickly, guys. Quickly. We're almost in 2 hours mark. Oh boy. Come on. Come on, guys. I just gave 3 options there so that I'll make it faster. I could have given 5 options, but I don't want to waste too much time. So, guys, the answer is A. Now, yes, okay, fine. Let me just tell you. The answer is A. The kidney is majorly cuboidal. Yeah, the answer is A. Remember, I told you the kidney is majorly cuboidal. Cup, or fluid is usually cuboidal. All right, but that thin descending loop of Henle. You see that? You see the proximal convoluted tubule. Then you see that the thin, it goes like this. All right, then the thick, then the distal the convoluted tubule. That thin part is simple squamous epithelium. Simple squamous. You understand? Sorry. Like when you're discussing, thinking about simple squamous. Yeah, because of secretion. Simple squamous usually allow tiny fluids to pass. So that part only allows water to pass through it. That thin descending loop. You understand? Or thin loop of Henle. Or thin segments. All right? Fluid. Just like the alveoli of the lungs. That alveoli allows gas exchange. That place is also what simple squamous. Remember, squamous is flat. Simple is one layer. All right. So I want you guys to remember that. All right, so that they don't shake you in the exam hall. Yes. So look at this question, guys. How do we distinguish these two guys? How do we distinguish these two guys? This is A. This is B. This is C. This is D. This is E. So, guys, what's the answer? What's the answer, guys? Cortical nephrons can be distinguished from juxtamedullary nephrons by what? Come on, guys. So the answer is A. Yes, a lot of people are putting question mark. Yes. Remember the difference between cortical nephrons? The ones are particularly in the cortex, the short ones, us, The ones that are in the nephron, in the cortex. And we have juxtamedullary, the ones that just are the medullary, They are taller, they extended to the medulla. So, the difference is usually their location. You see? Cortica, just at the medulla. Talking about location, anatomy, not physiology. It has nothing to do with their physiology. You understand? It's specifically anatomy. If you notice, every other thing there is talking about their physiology, filtrate rate, molecules that pass through, size of the corpuscle, whether they are collecting ducts, blah 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 blah. All those things are not, it's specifically their locations within the renal cortex. All right, where are they found in the renal cortex? All right, that's A. I told you, this is a serious question. Where is everybody? I don't understand. Are you guys tired? It will do me a word of favor, because right now I'm running behind time, but I really need to do this. So this will tell you, are you ready for the exam? You understand? Assuming you happen to be, this is the exam, what are you going to score? Do you understand the point? So this will really, that's why any exam you are doing, I will encourage you, go look for questions that are similar to that exam. Whether it's the exam question or not, it doesn't matter. You don't need the exam question. You understand? All you need to do is to practice, to attempt. The more questions you attempt, the more you learn. All right? So look at this question, guys. Which of the following correctly traces blood flow from the renal artery into the renal cortex? Let's see. Renal artery into the renal cortex. Where are my people? There are 3 more questions I want to give you, but you still need to go look at the review I did for renal and for fluid, please, because I'm already against time and you guys are not talking. What's happening? Wake up. I can smell that somebody is sleeping. I smell that somebody is sleeping. Wake up. Okay. Finally, they are up. So I just want to give you 3 more questions and I will leave you guys. I'll run away. Please. But that's not all. There are about another 20 questions that you need to know. But I need you to go and look at the renal. You see how we do this? That's how I want you to go and look at. That's how the videos are. Please just go and watch those videos. Please, you will see the importance. Even when you do your final exam, you still see the importance. Please. Yes, the answer is C. You guys are so correct. The answer is C, not D. It's C. Yeah. Which of the following correctly traces blood flow from the renal artery? You see, they're actually from out to in. Out to in. So it's segmental artery. Yes. See, yes. Segmental artery. You understand? To interlobar. From interlobar to arcuate arc. To arcuate. Arcuate, it gives cortical radiator. All right. Aha. You see, that cortical radiator is the same thing as interlobular, not interlobu, interlobular. You get? Aha. The other one is interlobar. So the answer is what? C. All right. So what of this one? Let me see how fast you guys can get this one. Options. I'll give you the options. A, B, C, D, E. Let's go, guys. Which of the following correctly traces blood flow from the renal cortex to the renal vein? So we have A to E there. Let's go, guys. I have to go and get a long comb and be combing this my beard like this. Okay, guys. The answer is E. Most of you are choosing D. Let's look at D. Let me see. Interlobar. No, it's they said which of the following correctly traces blood flow from the renal cortex? No, now you can't start with interlobar now. That one is medulla now. So that interlobar alone is already out of the equation. Let me still look at it. Arcuate. Interlobar did not come before arcuate now. No, before arcuate, you have cortical radiator. Then this was the interlobar, arcuate, cortical. How could you have arcuate before cortical radiator? And you have cortical radiator between arcuate and renal vein. No, that's so please, this question is tricky. Don't look down this question. Why am I looking up every time? Because I'm seeing you guys. Let me be looking here. So this question is very, very tricky. All right. I need you guys to know how to trace this question. Know where they're asking you from. They're asking from the renal cortex. You think about it. Oh, it's hard to be cortical radiator. Do you understand? Then backwards, arcuate, interlobar. It doesn't have segmental, so it goes straight to the renal vein. Make sense? Now I'll ask you the last question. then you go and look up the other things. Our review for digestive is enough for you for digestive, all right? But for this renal, I still need you to go and look up the review I did before for renal and also the video, please. And also the video. It will help you so much. I promise you that. And also when you are in the clinic, it will also help you in the clinic. B. C. This is the last question, please. I need to jump off. D. E. Guys, what's the answer? Which of the correct branching sequence of the arteries in the kidney? It's the last question, though, so everybody should attempt it. Yes, the answer to that question is A. Renal arteries, segmental arteries, and interlobar arteries. So, guys, you guys were really impressive, all right? I really love the fact that you are here. So don't take this for granted. You really brought out your time, and it's a good thing. You know, I appreciate you for bringing out your time. And I appreciate myself also for bringing out time for you. So please, you have to consolidate. Now you've learned a lot of questions. You have to consolidate. You see why just reading slide doesn't cut it? Because you can read these things in slide, but you can't still catch it. That's why I will encourage you guys, go and watch those videos, please. They are not just there for fancy. There's a reason why I have 50-something thousand subscribers. That's a reason why. All right. So I need you to subscribe, click the notification bell, tell your classmates in other classes, even the ones that are not in my class. It's not for me, it's for everybody, any country, any school, any class. As far as you are doing anatomy, physiology, microbiology, pathology, biochemistry, you have to be, clocked on here. All right. So I need you to go back and look at this question every day. Bring out 1 hour, look at these questions we've discussed. Do it every day till the day of your exam. All right. Please, I need you to go back and look at fluid and also some part of the urinary system. I just did the first part. There is another part. All right, please. Thank you, guys. All right. Remember me when you're answering. Okay, guys. Thank you so much. I'm going to log off now. I have to jump into another meeting. And it's nice meeting you guys again. So I see you when I see you. Thank you. Thank you so much. I appreciate. In sign language, we say thank you. Thank you. This is thank you. Thank you. Thank you. Thank you. That's how they do it. Okay. I'm going to go off now, right? I'm jumping off now. I'm jumping into another meeting. See you later.